A group of professionals and healthcare experts under the aegis of Redbridge Healthcare Group has advocated for a functional and all-inclusive employee medical benefits in the country. The group managing director of Redbridge Healthcare Group, Dr. Henry Onyemachi, who expressed this feeling at a press briefing in Abuja, also noted that Nigeria has not given healthcare services the priority attention it deserves. He, however, underscores the importance of employees' health need in every organization, adding that the output of any organization is largely dependent on the quality of health of the workforce. Dr. Onyemachi said that every employee spends 1/3 of their time in the workplace, hence the need to prioritize their healthcare need to ensure their optimal performance.
We decided to focus so much on employee healthcare for this thing I said earlier. Employees, those who work, spend about 1/3 of their lives in the workplace. And day in, day out, the choices that they make in the workplace, the things they do, the way they sit, the attitude and behaviors or habits that they develop. Sometimes you have irregular eating patterns, different kind of stuff. They affect the employees, even in their later life. So there is a demand and supply gap, which we're trying to bridge with this conference. So we're looking at a situation where in one place, the person who seeks a healthcare solution, the person who buys a healthcare solution, the person who enjoys a healthcare solution are able to interact on one platform.
He said that the annual conference is aimed at leading an advocacy on the need to prioritize the health need of the employee in Africa and Nigeria in particular, while adding that the conference would help encourage government to do more in the health sector. He decried the low percentage of Nigerians that are covered by the National Health Insurance Scheme, stressing that the coverage is in the neighborhood of 3 to 7 million in a country of 170 million people. Dr. Henry Onyemachi said that the country is far behind the global benchmark of budgetary allocation to the health sector.
It's been sad, and it's continuing to be sad, that Nigeria as a nation has not been able to prioritize healthcare. And if you want to know how important anything is to anybody, you want to know how much money do you spend on it. So sometimes if you want to know what is really important to you, you check your spending and see where your money is going to. Our budget, there was an Abuja Accord, meeting that held, and many countries came here in Abuja. And there was an agreement that countries should be able to spend 15% of the budget on healthcare. Nigeria has not passed 5%, since that declaration happened. And that happens year in, year out. So in healthcare expenditure in Nigeria, you find that many people, the burden of healthcare is borne by households.
On her part, a representative of the medical services organization Healthcare Risk Managers said that the conference enjoys the blessing of the Nigerian Medical Association and the government, as the Ministry of Labor and Employment is fully committed to ensuring that the noble objectives of the event is actualized. She also gave reasons why her organization is sponsoring the project.
MSO is an international company, and we support organizations with innovative technology solutions as well as health insurance cover tailor-made for the specific company of various sizes. MSO is in 46 African countries and are here to support health meetings in rolling out the employee benefit awareness in the future.